You have worked your entire life for your hard-earned money, and nothing, I mean nothing, will drain your retirement nest egg faster than an unexpected medical crisis combined with a careless Medicare enrollment mistake. People come to me all the time, completely confused, completely overwhelmed, and asking, "Susie, I'm turning 65. What on earth do I do?" And I get it. You are inundated with junk mail, glossy flyers, and television commercials trying to sell you something. First, let's address the biggest fear and question people have. Do I have to sign up the second I turn 65? The answer depends on your situation, but you need to know your clock. For most people, your window is called your Initial Enrollment Period. It is a 7-month window that opens 3 months before the month you turn 65, includes your birthday month, and extends 3 months after your birthday month. Mark those dates on your calendar. If you miss this window and you don't have valid coverage elsewhere, you will get hit with a 10% penalty on your Part B premium for every single 12-month period you were eligible but failed to enroll. And that penalty is not a one-time fee, you pay that extra percentage every month for as long as you have Medicare. Why give your money away to penalties when you could keep it in your bank account? Now, what if you are 65 and still working? This is where so many people make a catastrophic mistake. If you or your working spouse have group health insurance through an employer with 20 or more employees, that coverage is considered primary, and you can generally wait to enroll in Part B without penalty until that employment ends. You will get a special enrollment period later. But listen to me carefully, if your employer has fewer than 20 employees, Medicare becomes primary the month you turn 65. If you don't sign up for Part B, your small business insurance may refuse to pay your medical bills, leaving you 100% on the hook. Do not assume your HR department knows your personal numbers. You need to verify if your coverage is deemed creditable for both medical and prescription drugs. Step 1 of your actual setup is getting your base coverage, Original Medicare. Part A is hospital insurance, and for almost everyone who has worked at least 10 years and paid Medicare taxes, Part A has 0 monthly premium. You sign up at ssa.gov. Part B is your outpatient medical insurance, doctors, specialists, testing, and preventive care. Part B requires a monthly premium. If you are already taking Social Security, you will usually be automatically enrolled in Part A and B. If you are not taking Social Security yet, you must manually go online to ssa.gov 3 months before your 65th birthday month and enroll. It takes less than 10 minutes online. Do not wait for someone to mail you a paper form. Take control. Step 2 is where you face the biggest fork in the road, and you need to pay close attention because sales agents love to steer you down the path that pays them the best commission. You have 2 choices for your comprehensive coverage, Route A, which is Original Medicare combined with a Medigap policy and a standalone Part D drug plan, or Route B, which is a Medicare Advantage plan, Part C. Let's look at Route A. Original Medicare covers roughly 80% of your approved medical costs. There is no out-of-pocket maximum on that remaining 20%. That means if you face a $200,000 hospital event, 20% is $40,000 coming right out of your savings. To fix that risk, you purchase a Medicare Supplement Insurance Policy, also known as Medigap. When you pair Part A and Part B with a Medigap plan, like Plan G, and a Part D prescription plan, you have almost total freedom. You can see any doctor, any specialist, at any hospital in the United States that accepts Medicare, with no network restrictions and no prior authorization hurdles. You pay higher monthly premiums up front, but your medical bills become predictable, fixed, and stress-free. Now let's talk about Route B, Medicare Advantage. Advertisements splash $0 premium all over television screen to tempt you. But listen to me, nothing in life is free. Medicare Advantage plans are private HMOs or PPOs. When you sign up, you trade the nationwide freedom of Original Medicare for a private insurance network. You are required to use network doctors, get referrals, and obtain prior authorizations for procedures, scans, and treatments. If you stay healthy, low or zero premiums sound great. But if you get sick, you pay copays and coinsurance out of pocket up to the plan's annual out-of-pocket limit, which can easily reach $8,000 or more a year. Furthermore, if you choose Medicare Advantage now and try to switch back to original Medicare with a Medigap policy years later, insurance companies in most states can put you through medical underwriting and deny you coverage based on pre-existing conditions. When you are at your newest to Medicare, right when you turn 65, you have a 6-month Medigap open enrollment period where no company can deny you a policy regardless of your health. Do not throw that protection away without knowing what you are doing. Step 3 is setting up your prescription drug coverage, Part D. Even if you don't take a single prescription drug today, you must buy a basic Part D plan during your initial enrollment unless you have creditable drug coverage elsewhere. If you skip Part D because you say, "Susie, I don't take any pills," and 5 years from now you get diagnosed with a condition requiring medication, you will face a cumulative 1% per month penalty for every month you went without drug coverage, tacked onto your premium forever. Go to Medicare.gov, use their official plan compare tool, type in your specific medications and preferred pharmacy, and pick the plan that offers the lowest total annual cost, not just the lowest monthly premium. Your actionable takeaways starting today. First, check your calendar 6 months before you turn 65. Second, verify whether your current workplace health coverage requires you to sign up at 65 or lets you defer. Third, log on to ssa.gov to apply for Part A and Part B 3 months prior to your 65th birthday month if you aren't drawing Social Security. Fourth, compare Medigap versus Medicare Advantage based on your financial ability to absorb unexpected medical costs, not just upfront premiums. And fifth, lock in a Part D drug plan to avoid lifelong penalties. Take charge of your health, stand in your power, and safeguard your retirement dollars. You have earned every single penny, so protect it.